Very good evening. Thanks for joining us here on the Sunday edition of the Urban Debate. I am Afrida Rehman Ali. With the daily count of COVID-19 cases increasing by more than 10 times in 6 days in West Bengal, the Mamata Banerjee government in the state is in a bit of a fix. First announcing a partial lockdown from Monday, shutting schools and colleges, restricting timings of local trains, capping attendance at private and government offices at 50%. But what has sparked off a debate now is the additional restriction on flights, where curbs have been imposed on flights coming in from Delhi and Mumbai. Flights from Delhi and Mumbai will be allowed to land in Kolkata only on Mondays and Fridays. Now, earlier, the government last week had announced suspension of direct flights from the United Kingdom and mandated COVID tests for all passengers arriving on international flights. But now a similar imposition, a similar curb on domestic flights as well, raising a few vital questions on can states take such a parochial approach to prevent domestic flights as well, where it senses a risk. Is the state of West Bengal being protectionist, or is this, after all, a preventive step, given the number of cases in the state? So to discuss this issue, let's welcome Dr. Rajib Dasgupta, Chairperson, Center of Social Medicine and Community Health in JNU, and also member of the National COVID Task Force. Joining us is also Dr. Om Srivastav, member of the Maharashtra COVID Task Force, and Dr. Bishnu Panigrahi, Group Head, Medical Strategy and Operations, Fortis Healthcare. Very good evening, gentlemen. Thanks for joining us here on Mirror Now. I want to begin with you, Dr. Dasgupta. State after state are now taking decisions on curbs and restrictions, issuing guidelines, issuing advisories. But the curbs that have come in, it displays a certain sense of nervousness as well. And there are in certain cases, knee-jerk reactions, what we are getting to see and hear. How do you look at this decision of the West Bengal government to curb flights coming into Kolkata?
Thank you. To put it as delicately as possible, it simply makes no sense. I would reiterate what the WHO advisory is, that there should be a thorough risk assessment process informed by local epidemiology, and most importantly, and I quote, blanket travel bans will not prevent the international spread. Now, the travel related restrictions were at a certain point in time considered, and mind you, that's in the pre-Omicron phase, in the very initial stages of the COVID pandemic, when it was really a novel disease. It's no more a novel disease now. And that also came with certain specifications. But with the onset of Omicron, the WHO was very clear that there is no room for any international travel bans, though some countries initially imposed those on incoming passengers from some of the southern African countries. And the IATA in the first week of December, if I remember correctly, urged all countries to pay heed to the WHO advisory. But all of this is, as far as international travel ban goes, simply picking on UK doesn't really make any sense. Mm-hmm. And there is certainly no room for such restrictions on domestic air travel. And furthermore, it's simply a minuscule proportion of incoming people across state borders. So yes, epidemiologically also, it's completely irrelevant.
Those are very important points. So therefore, is this prudence, or is this, a bit of trying to minimize responsibility, that fewer number of patients from the worst affected cities, fewer tests or to be conducted in the airports, or fewer precautions or measures to be taken at the airports? Where do you stand on this, Dr. Srivastav? If you ban flights from Mumbai, which is the financial capital, it has a repercussion. I mean, we are all connected by trade and travel. It will have an impact on businesses as well.
You're absolutely right. Thank you for having me on your show. What are you going to do about the non-air passengers? Are you going to restrict all train travelers, all people coming from other states? Because the numbers are not dwindling or falling in any of the states. They're only climbing. So how much sense is there to restrict people coming from Mumbai, and only to restrict people coming by aircrafts? You'll probably need to have a blanket ban for anybody, and that is probably going to be putting a huge amount of pressure on the resources of the government of that state on that given day. So I agree with Dr. Dasgupta in that, is it only going to be a knee-jerk reaction? Is it cosmetic? Is it only going to be preemptive? We don't know, not at this stage at least. We'll probably have to see what happens as time goes on. But by all projections, the total number of Omicron and COVID-19 cases are going to be climbing. So we probably need a better strategy for all states, because none of the states, whether it is, one state that you just mentioned, but
Yes.
also other capital cities in the country, they all have people where there are migrant laborers or people who travel on a daily basis. You'll probably need to have a policy for all such people coming in. Otherwise, to restrict just the one part, which is airborne travel, I don't see how that's going to impact on the total amount of disease progression in that particular state.
Yes, and just to talk about where this is coming from possibly is that, of course, that there has been an exponential rise in the number of cases. Fresh restrictions were announced today by the West Bengal government after the state reported 4,512 new cases, which translates into an increase of daily count of new COVID cases by 10 times from last week. Therefore, in the very beginning, I asked this question, is there a certain nervousness, anxiety? But the fact of the matter is, this would affect or this could actually spark off some sort of a chain reaction. Other states could also consider, as a quid pro quo, and that can never be a good thing. Dr. Panigrahi, what are your thoughts on this?
Afrida, thank you for inviting me on this. I'd like to take a little contrary view on this, is that I think so the government is taking a preventive action. Okay. If you look at the Omicron, Mumbai and Delhi, the maximum number of international travelers, they land here. So when you look back over the last couple of weeks, these are the two areas, whether it is the national capital or the financial capital, which have borne the brunt. So, and if you look at those who will be traveling to Kolkata, and who have come from abroad, they'll go obviously by air. They'll not go by train. So extrapolating that, what I such, I'll put the caution preventive thing on the first thing, and I agree we should not be pressing the panic button, because Omicron, when you look at it, when you compare with the Delta, it is not as virulent, but it is very transmissible. So actually, what is on the table is that since it is so transmissible, even people who have been fully vaccinated, and a lot of them, they can be asymptomatic, and they may land up in the airport and immediately testing negative. But if they have picked it up on the while traveling.
But Dr. Panigrahi, what the other panelists were saying is that this is the proportionality point of it. This is going to be a very small, minuscule number. How are you going to stop trade and travel by road, by trains? Why only address the air passengers? That is one of the points.
Yeah, Afrida, I'm answering that directly. Here is that, see, these are difficult times. So to be fair to the government, they have to work within whatever logistics that they have to see that the easiest mode is the air travel, where it can spread from, whether it's from the national capital or from the financial capital, where the maximum number of cases are there. So let us be fair to the government and let them work out something to see that the people coming from these two, I belong to Delhi NCR. Obviously, if I have to go to Calcutta, I have to follow the norms. So I think so. It's to be fair to the government. Let's say that let's not be too harsh on them. And it's more of preventive measure.
More of preventive measure. It could be temporary, and of course, it's not an entire blanket ban. There are only 2 days of the week where flights are allowed. But one panelist, of course, here saying that this is preventive. The other two experts saying this does not make sense. I would ask Dr. Dasgupta this question again, that, the government in its wisdom has taken these steps. Of course, every state has their own system of having a task force and taking advice from experts like yourself. Do you think there's any particular reason why Kolkata, in this case, feels that they have more to gain by blocking flights from Delhi and Mumbai to a certain limited extent?
Well, this certainly defies any epidemiologic rationale. It would be good if they actually set out what their rationale is in the public domain.
Okay.
But being fair to the government of West Bengal, like what I can vouch for certainly is, at least last week when Omicron was as much spreading, no arrivals in Calcutta airport were I mean, travelers were not even asked to show their vaccination certificates. So let's not get too much into the wisdom of what is actually being practiced. As far as public health decision making is concerned, the driving rationale as far as Omicron. Now let's make a distinction between this particular Omicron-led surge and what's come to become a conventional wisdom vis-a-vis COVID. And I would make a very fine and nuanced distinction between the two. What really are the symptoms of Omicron? Omicron is really like a bad cold in the vast majority of cases, and therefore Omicron has and will continue to spread inexorably under the radar. These kind of very minimal arbitrary radars are not going to halt an infection such as Omicron in any conceivable manner.
Okay.
And therefore, public health decision making requires both rationale as well as some lived experience of an ongoing pandemic. One really can't put the same benchmarks across the various variants of COVID.
Yes, absolutely. Dr. Om Srivastav, when it comes to the governments of the day, there are two things that they can do. They can impose curbs and restrictions and enforce the protocol, and they can pace up vaccination. Do you see a tendency that, the thrust is more on penalizing people, restricting people, and somehow the vaccination pace, and I'm not talking about the new beneficiaries that's starting from tomorrow, but so far the adult vaccination program also has slowed down, and there I don't see as much of a focus. Is there anything you would like to say on that? Is the government of the day not prioritizing where it should? Instead, this is a case of misplaced priority?
Very true, Afrida. And there are three parts to your question. Is there a priority that might have been misplaced? I think that when you look at the numbers that Omicron has, there's always going to be a disconnect between the number of people who deserve the vaccine and people who have come forward to take the vaccine. That is one. The second part is that there is always going to be a little bit of vaccine hesitancy. That applies to a number of conditions, whether it is H1N1, whether it is other conditions. There's never going to be a situation where 80% of the population will come forward and say, yep, we're ready to take the vaccine, because most times there is the hesitancy. That is true. And the third thing is that even if you give the vaccine starting tomorrow, if you give it to hundreds and hundreds and thousands of people, it is going to take about 2 weeks' time, 10 to 14 days, for anybody to start making the antibodies. In some instances, it's going to take 3 weeks' time. So what are you going to do about the people in that duration? You can't simply say, you've taken the vaccine, now get back to work or socialize as you'd like to. These are things that you will need to consider in the numbers that they're going to climb. We know that as far as the patterns of Omicron all over the world are concerned. And there again, as was just asked again by Dr. Dasgupta, why single out the UK? What about the other countries where people are coming, where the number of people in that country are so humongous that you should be looking at restricting those countries coming into India as well. So I think that, these are policies that will need a little more clarity. I'm sure that these are policies that are a work in progress, but they probably need to be evaluated not just on a daily basis, but pretty much on a twice daily, thrice daily basis, if we are going to have something that is going to impact public health and the impact of public health by something like Omicron.
Yes, and I would agree with one point that Dr. Dasgupta made earlier about how in the Kolkata airport, and I also landed there a couple of weekends ago, and I could see that there was absolutely no testing, no checking, no asking for the vaccination certificate. So is this a bit of posturing to be seen as doing enough? That is one question, Dr. Panigrahi, because where I'm coming from is simply this, that a lot of these decisions, many experts before also have said, is not backed by science. And we have a similar opinion today also, Dr. Dasgupta saying that epidemiologically this is not making sense. Your response, sir?
Yeah, Frida, what Dr. Dasgupta said about not being vigilant in the airports. I think that needs to be that gap needs to be closed. Because I remember a couple of weeks back, I had gone to OT, and you had to show your vaccination certificate. You had to have a RT-PCR negative there to get into hotel. So I don't extrapolate that, but at least in the airports, the vaccination certificates, double vaccination certificate should be there. If you're not there, depending on the state to state, a negative RT-PCR should be there. So the basic screening has to happen in the airport. And if that is not happening, that's a big gap that's there. So while I agree that this may be looking very arbitrary and drastic, but we need, these are difficult times, as I said, mentioned earlier also. So I think we need to have some way to sort of screen out the patient, the travelers who are coming in by air from Delhi or Mumbai, because this is where the maximum surge has happened. So, and because this is a highly transmissible virus, although it's not as virulent as the Delta, so some sort of screening has to be there, some difficulty we have to bear with it.
Absolutely. And, of course, at this stage, all of us, and it has happened, of course, that people have a difference of opinion. In this case also, there might be two opinions, but largely the idea is to focus on what is most important at this stage, what is most important to restrict the spread. I'll take quick last word from everyone on this. Dr. Dasgupta, you first. What would you say for the government to do as the first step, as the immediate step? Because clearly we can see the phenomenal rise in the number of cases. What should state governments and the centre be doing immediately?
We are yet to witness a lot more of rise. Remember, even 1.5 months after this was recognized, South Africa's test positivity rate remains above 20%. And if my recollection is correct, Mumbai's test positivity rate today was about 13%, and West Bengal, I'm not too sure, it's perhaps between 5 and 10%. So
yes,
if you panic at 5 to 10%, that's not really very, very helpful.
Okay.
Most importantly, I would really like to reiterate the basic mantra that the WHO set out, is to escalate these in a timely manner to avoid overwhelming demand on healthcare services. Now, that really is the mantra. The singular feature of Omicron is what's known as a decoupling, which is an increase in infection, but a relative decrease in hospitalization rates. The states would do good to publish hospitalization data rather than, in addition to what's being published now. And therefore, the focus should be on avoiding overwhelming demands on healthcare services rather than arbitrary bans.
Yes, but we have to confirm these figures. But what I understand, as since you brought out the issue of positivity rates, the Kolkata's weekly positivity rate has risen to 23.4% for the week 24th to 31st December.
That's pretty realistic. That's why I quoted the South African figure.
Yes.
If it is 23%, I stand corrected. That's pretty realistic. But this is not to panic.
Okay, not to panic.
Take it
yes.
Right. Yeah.
Okay, last word, Dr. Om Srivastava.
So again, going back to the recommendations that have been made in the last year and a half, I think that people who have a classic definition of mild disease or even moderate disease should be treated either in the home quarantine facility or in something like the dome facility, at least in a city like Mumbai. That's what the state has tried to do. The center and the state must look at having huge number of such facilities where such patients who don't necessarily require to go to a hospital, because those beds must be kept vacant for people who need intensive care units.
Okay. Right.
Or who
Very
need
important.
ventilators. Those beds must be kept vacant. I think that even if those beds are vacant for a number of days at end, I think that would be still a fair practice. Omicron, the way it is, whether it is coupling or decoupling, whether you've got COVID and you need intensive care unit, those are the patients that need to go to a hospital. There must be a strict criteria of how you can decide which patients need such facilities, and that patients who are deserving must be admitted to such hospitals. Other than that, all other patients need to be kept either in a dome facility, which is thousands of beds. There are at least 5 dome facilities in the city of Mumbai who are doing a fantastic job. And such patients should be treated either there or in the confines of their own home. Of course, unfortunately, Mumbai, and I'm sure Calcutta and Delhi, the way they are, I don't think there's going to be enough place for people to be living in a single room, because that's the nature of the beast. But if it's possible, they could be done at home, treated at home.
Okay.
If that's not possible, they come to a non-hospital facility, and hospital facility is kept for the last 5% of patients who are genuinely, truly deserving.
Okay, that's a very important point that you raised, that the focus should be on understanding, structuring, streamlining the health infrastructure so that we can cater to the worst case scenario. I'm running out of time. Dr. Banerjee, your last word on this, please.
Yeah, my punchline will be that please wear the mask, because that the portal of entry is the nose. And Afrida, you are showing some visuals now. Yes. You can see so many people not wearing the mask. So I think that this is where we should clamp down. And testing, surveillance and tracing is a must. And as Dr. Dasgupta mentioned, because I'm from Fortis Healthcare, and across a network of hospitals, a lot of healthcare workers have already got affected. So to his point is that we will be inundated and a lot of our workforce will get out of work. And we don't want that to happen, because they need to be there at the front line to serve the patients. So masking, testing, surveillance and tracing. And masking is the most important thing that I would like to put across.
Yes, thank you so much for all your views. Thanks, Dr. Dasgupta, Dr. Srivastav and Dr. Banerjee. I would just like to conclude by saying we are together in this. So how good an idea it is to be parochial, I am not too sure. The experts feel that this will not work out, because we have to make a collaborative, cooperative effort in this to fight the pandemic. Thanks very much for joining us. Thanks for watching.